I got the fun topic, perimenopause. Yay! So we're going to end the night with a little fun. All the other speakers have covered all the important stuff. They have said so many things that are vital in understanding. We'll just have a little bit of fun here. So what exactly is menopause? Well, truthfully, perimenopause, there's no exact description for perimenopause. If you look, you'll find a definition that says the time before menopause when your body's getting ready to stop having periods. Well, okay, we all knew that, right? Sometimes called the menopause transition. And symptoms of perimenopause can appear as early as your 30s and as late as the 50s. So let's just put it into everyday talk. What is perimenopause? Have any of you ever experienced PMS in your life? Yeah. So PMS, you have bloating and weight gain and crankiness and acne and cravings. So basically, perimenopause is that for 10 years. It's a long haul. It can be that for 15 years. It can wax and wane, exactly like Stephanie said. It can wax and wane. Estrogen is your main female hormone. During perimenopause, the estrogen levels, just like Stephanie said, rise and fall every single day. So if you drew an FSH level, that is a one-day snapshot. So that's like if a person in your family took a 2-week trip to Italy and they said, look at my pictures, and you opened the photo album and saw one picture and said, yeah, that looks like a nice trip. That's what happens if you draw hormone levels in the perimenopausal period. Most symptoms associated with perimenopause and menopause are lowering of your own natural estrogen levels. So here's some of the changes that occur in perimenopause, and every person's different and everything is different, but you can skip ovulation, which means you don't release an egg, or you can have unpredictable ovulation. Sometimes periods are longer, sometimes they're shorter, sometimes heavier, sometimes they're lighter. That is why it is so hard to define perimenopause. Cycle timing can vary. You can skip cycles or you can have more frequent cycles. Here comes the ones we recognize. Hot flashes. I had hot flashes so bad that my face would turn like beet red, and I'd be in a conference room or in a meeting and people would go, "Are you okay? Do we need to call someone?" I actually had my nursing friends one time take me down to the ER because they were certain I was either having a heart attack or stroke because a hot flash hit me so bad and I felt awful. And then I had the physical proof something's changing. Night sweats. I mean, I'm sure you've all heard of night sweats. Raise your hands if you've experienced night sweats. Night sweats are pretty significant. When they started for me, I really wasn't sure if I was the campfire or the marshmallow. I just knew that something was on fire. My husband would lift the blankets and go, "Is there smoke coming out? What's wrong with you?" And the night sweats severely changed my ability to sleep. Sleeping can be different. Your sleep cycles can change. Some women get lucky and have an increase in libido during this perimenopausal time, but some people have a decrease. One very bothersome symptom is vaginal dryness and pain with intercourse. And Stephanie covered that brilliantly. I cannot say enough about vaginal estrogen. You can use that as early as you need it. You can use it in any perimenopause, and you can use it throughout menopause. Mood swings and irritability. That's a common complaint for perimenopausal women and their husbands because they can absolutely see the change in mood swings and irritability. One we're hearing a lot about is increasing inflammation and joint pain. And they're now linking estrogen to joint pain, inflammation. And so will estrogen help that? Is that a possibility? Shoulder pain. We're hearing a lot about shoulder pain. I'm just recovering from frozen shoulder syndrome. And the PT department got me through it without surgery. Did have some injections, but I mean, it was so frozen that I had to eat dinner like a T-Rex down here because I could not move my shoulder to cut my food and eat my food. And so, you look and you say, as a woman, why do we have shoulder pain? Well, think about everything you do with your shoulders, right? And the shoulder is a joint we rely on a lot. I mean, think of all the things we do. We vacuum floors, right? We dust mini blinds. We hang up all the laundry. We might mow the grass or weed eat or edge the lawn. And we do all those things before our husbands even get out of bed on a Saturday. So no wonder we have sore shoulders, and mine got frozen. But thanks to physical therapy, it did get unfrozen. Something about perimenopause, and this is something really important to know. You are at risk for bone loss. Estrogen kind of joins onto calcium, vitamin D, and helps build your bones. So that's something when women say, what can I do naturally to protect my body or help my body? And absolutely, calcium and vitamin D3 are good, okay? You're sometimes at risk for increasing cholesterol levels and then brain fog. And if you've never had brain fog, consider yourself very lucky. When I was actually putting my slides together, I got a text from my 43-year-old daughter. I have a friend, and she would like to know if she can start estrogen replacement therapy at 43. And I said, did that friend have a hysterectomy last November that her mother came down for? She goes, yes. She goes, Mom, something's happened. I'm going through menopause at 43. And I said, honey, we talked about that. When you remove the uterus, you are at risk for earlier signs of menopause and perimenopause. She's going to the doctor first thing in the morning. She got a quick appointment, and she's asking for estrogen, and her main complaint is brain fog and hot flashes and night sweats. So all those things sound delightful, right? This little person, doctor, says you need strong medicine to relieve your symptoms. I'm prescribing chocolate. If you're going to do the chocolate, do dark chocolate, because it actually does raise your serotonin levels. You're going to be happy to know there's help for menopause. But we have to sort out, just exactly like Stephanie said, your risk factors, who should take, what you should take, and what's your options. So women that smoke, menopausal symptoms will begin earlier. If your mother, sisters went through menopause earlier, that may be something that you keep in mind. You may experience menopause earlier. I did go through menopause in my 40s, so it's making sense that my daughter at 43 is feeling those signs. If you've had a hysterectomy, if you keep your ovaries, you still can experience menopausal symptoms early. Things that confuse doctors with perimenopause, hot flashes, night sweats, brain fog, fatigue, you have to rule out thyroid disease. You have to rule out autoimmune diseases, rheumatoid diseases, and anyone that's been on a medication for a cancer treatment or other specific medications can make the same similar symptoms. How do you diagnose perimenopause? We'll have to run a food test to be sure, but it's either hot flashes or global warming, because that's exactly what you feel like. And so Stephanie talked about this. The FSH levels rise and fall from day to day. So one test does not a diagnosis make. There's nothing that can say, oh, yes, you are perimenopausal. But all the things we're talking about can help your provider come to the conclusion that you do need to look at some options for treatment. An elevated FSH level greater than 30 that is present with irregular or absent cycles, that's indicative of a menopausal transition. But it's not always a diagnosis because there's a 2-year window where you can still have some periods throughout that 2 years. Menopause is actually defined as 12 months without a menstrual cycle. So what do we do about the symptoms? We all know we have them. Is there any hope? Is there any help? Yes, there's a lot of help. Can you give me something to make my hot flashes hotter? I'd like to melt fat, burn calories, and ignite passion. Well, here's something. There's not one medication to treat all the symptoms. And when patients would come in with a whole list, and I do encourage you to make a list prior to going to your doctor, and I would look at them and we would talk about the things on the list, and then I'd say point to the one that bothers you the most, because there is not one treatment or one medication that's going to help everybody. It's best sometimes to hone in on what's the most important thing to treat. So you need to still think about contraception in your 40s, right? Because you can still get pregnant in your 40s. Ovulation can be sporadic. If you're using natural family planning, it's difficult to predict when you're ovulating. So you need to think about contraception even throughout your 40s. In our practice upstairs, we had a lady 51 or 52 that had an unintended pregnancy. It can happen. So think about that and protect yourself. But here's some things we need to know. Some contraceptions contain both estrogen and progesterone. And during this 10 years of perimenopause, it's absolutely acceptable to do a low-dose birth control that provides you contraception that you need and absolutely will abate all the symptoms that we have talked about. There's even a new, well, it's not brand new, but it's newer to the genre of birth control. It's called a low oral contraceptive that might be helpful for you. Very small dose. The dose that you take in contraception will definitely relieve night sweats and hot flashes. If you use a Mirena IUD or an Explanon or Depo-Provera, those are progesterone-only products and don't help with the hot flashes. There are some contraindications to taking estrogen and progesterone. So like everyone's talked about, these things have to be looked at carefully. Migraines with aura, smoking over the age of 35, we don't do combination contraceptives with, hypertension or cardiovascular event like a heart attack, history of a blood clot or a blood clotting disease in you or your family, you need to seriously consider different options for yourself that possibly are non-estrogen containing. Other chronic medical conditions, diabetes and thyroid, also make your symptoms worse. But this is a really big one. And this is a real quandary as a provider when people came in with abnormal periods. Because there's that window that you have to ask yourself, did you go through menopause and is this postmenopausal bleeding? Which is serious, right? That has to be evaluated. So how do we know if you've gone through menopause, if it's postmenopausal bleeding or abnormal bleeding or too many periods or too heavy bleeding? That has to be thoroughly evaluated ever before starting any type of hormones. So let's explore some options to treat those things. So hot flashes and night sweats, a low-dose combination birth control pill, if that works for you. You can even use low-dose hormone replacement therapy when you're still having periods. Again, it has to be an estrogen and a progesterone combination. If you say, hey, you know what? Estrogen and progesterone aren't for me. What are my other choices? Gabapentin, it's an anti-seizure medication we know helps hot flashes. So that could be an option for you, and it helps sleep too. Clonidine is a blood pressure medication which controls vasodilation that can help hot flashes. I'm sure you've all heard of Veoza. That's the not flash commercial on television. When people go, that's not a hot flash, it's a not flash. Well, Veoza is new. It works. It's amazing, but it's super expensive. And a lot of insurances don't cover it. But there's really good coupons for it. So you can get it at discount pharmacies, and there's good coupons for it. And now that it's been out about 2 years, some insurances are starting to pick it up. But it does specifically just control hot flashes. Mood swings and irritability. You know, when you're in the perimenopausal or menopausal stage, the mood swings and irritability, has anybody ever had that? You know, you just know you don't feel like yourselves. I mean, sometimes I couldn't even stand the way my husband breathed, you know, and he can't eat cereal in front of me. That's it. You know, it's just no cereal. You can't have it. I mean, when I was in the perimenopausal period, I stopped making him corn on the cob because that would send me over the edge. You know, it's like, no, it's not going to happen. Now that I'm through that, I'm back to myself. We went to the farmer's market in Liberty, and we bought corn on the cob this summer, and he's like, golly, how long's it been since we've had this? It's been decades. This is delicious. But yeah, you can eat it now. Prior to, no. But I can tell you, I also had some help from, like Zoloft really helped me. SSRIs, they're serotonin, selective serotonin reuptake inhibitors. They really do help. An antidepressant. We did couples therapy. That was very beneficial and very helpful. There are things you can do besides hormones, so that doesn't always have to be estrogen or progesterone. Decreased libido or painful intercourse. Like Stephanie said, vaginal estrogen. There's vaginal rings, there's vaginal creams, there's vaginal patches. There's a specific medication that works on vaginal dryness, which is a selective estrogen modulator. Some people use a testosterone supplement to help their libido. And do you know, serendipitously, over decades of use of Wellbutrin, I was really glad to see the weight loss physician talk about Wellbutrin has other uses. Weight loss was one she talked about today. How cool is that? But we know as OBGYN providers that it can help your libido. And so when I prescribed Wellbutrin to a lady, look at the things that it can help. It can help with irritability and mood swings, right? Because it's an antidepressant. Serendipitously, it can increase your libido. So that's nice. So I would have people back for the 3-month checkup, and I would say, how are you doing? And there's like, my husband sends his thank you. Like, I am so glad that it's working for you. We haven't talked about fatigue and weight gain. You know, that's part of the perimenopause thing. Any onset of significant new fatigue, we always want to keep in mind and think about comorbidities. It needs to be evaluated. If you are having significant fatigue that's new and concerning, go to your primary care doctor for sure. But I will tell you, your metabolism does slow down a lot. You know, we went to a wedding last weekend, and I didn't have time to go out and shop for anything new. So I went through 75, maybe 85% of my closet, and like, that's 20 pounds ago. That's 30 pounds ago. That's 15 pounds ago. And really not not a lot's changed because I eat about the same. I'm a pretty good eater. I walk and I exercise, but my metabolism has slowed down. When we ask for a smoking hot body, this is not what quite we had in mind. But to fight that and work on that, we need to talk about a few things. But I wish I could lose weight as easy as I lose my keys, my cell phone, certainly my temper, and definitely my mind. These are what you have to do. When patients would say, I cannot lose weight in perimenopause or menopause, I can't. And I would say, tell me what you're trying. Tell me what you're doing. We have to be so honest with ourselves and our providers. And I would say, here's an oversimplified answer, and that's put your tennis shoes on and walk. And that's it. That's what I do while I walk. But it has to be intentional and has to be planned into your week. Walking can improve energy. It does help ramp up your metabolism, which will help drive your weight loss. But I should have put this on there, and I forgot. Guess what it also does? Increases your own natural testosterone, which will increase your libido. So when you exercise, again, one thing is working on several symptoms. And you feel better about yourself. That's good too. But there's so many options for exercise, just intentional, some type of exercise. Meal planning, I follow these two pretty closely. An anti-inflammatory diet, a Mediterranean diet. But the one thing you want to do is reducing your sugars to decrease your own body's inflammation, because we are going to be more prone to inflammation when our estrogen decreases. But I can tell you that sugar increases your own body's inflammation. So a general rule of thumb for me, water is the only thing I drink. And yes, I do love Coke. That's my very favorite thing. And I mean the real stuff. I do not like diet drinks. And so I want the real stuff. But I just decided that's an easy fix for reducing some of the sugars. But also talk with your primary care doctor about your weight loss goals. Many options are available. We have our weight loss clinic right here at North Kansas City Hospital, and they have so many options like they talked about earlier in the evening. If you're having symptoms, make an appointment with your provider that you trust and make a list that you would like to take in with you and talk about your concerns. List of symptoms and list of questions. But what you need to know is that every single woman does go through periods, perimenopause, and menopause. It's important that you don't suffer in silence because perimenopause lasts a long time, right? So there's so many options that can help and treat you. Getting a provider on your side that takes you seriously and is really, really invested in working with you makes a huge difference. Some supplements that I think are easy peasy, grab at the grocery store. I don't know where it went.
Oh shoot, I did your slide. I didn't put them up there. What did I?
That's okay. I can tell you what they are. Supplements, calcium, 1,200 milligrams a day. Vitamin D3, 600 to 800 international units daily. Think about your bones like your 401k plan, right? You save your whole life in your 401k, and over little bits, it adds up. So bone density is just like that. You have to make deposits in your bone density for it to last you through your retirement years into old age. And you cannot always build bone at the rate that you can as a young woman as compared to an elderly person. There's this window in your life when you're having periods, you build more bone, right? So you need D3 and calcium while you're young. Don't wait until you become menopausal because bone building capacity has significantly decreased. So vitamin D3, calcium. Magnesium is really good for sleep. It really is. Magnesium glycinate or L-threonate, magnesium L-threonate. But those are some of the basic supplements. And I do believe in just a women's multivitamin, all around general multivitamin. Okay. All right.